Hi everyone, my name is Isolona. Today I'll be talking about natural ways to boost your fertility, especially for women who are trying to get pregnant. I will be explaining clearly, no confusion, no big medical words, so that you can understand your body better and know what to do. Now, my number one step will always be to track your menstrual cycle. Yes, you have to track your menstrual cycle. And this is your first step to do so that you can know your fertile journey. Now, your fertile window is a period during your cycle when you have the highest chance of getting pregnant. And you might ask, what is a fertile window? Now, this fertile window usually lasts for about 5 to 6 days. So it often lasts 6 days, that is 5 days before ovulation, and then on the day of the ovulation itself. And now by ovulation, I mean the release of egg, okay? Just the release of egg. Now that egg is very important simply because that egg is needed to be fertilized, okay, by the man's sperm for pregnancy to take place. That's the clearest term or clearest way I can explain it. So that's the importance of the ovulation and the egg and fertilization. This ovulation usually takes place 12 to 14 days before your next period. Now, how to know your fertile days? Let's do this calculation. Now, on fertile days, you find your best days. So if your period is regular and it comes, take for example, every 28 days, ovulation will likely happen around the 14th day. So your fertile window will be roughly day 9 to day 14. Now, the best time to have intercourse to help you maximize your chances of getting pregnant is to have intercourse 2 days before your ovulation. That is the day before your ovulation and on the day of your ovulation. Now, this is very important to help you on your fertility journey. Now, my second tip would be to maintain a healthy weight. Now, trust me when I say healthy weight supports fertility, and that's a fact. Now, your body hormones, especially the ones that control ovulation, I've already explained ovulation earlier, they work best when your weight is balanced for your height. Why this is important is because weight affects hormones plus ovulation. Weight affects hormone plus ovulation. So being underweight or overweight can affect ovulation and make your menstrual cycle become irregular. And you might ask, how do I know that I have a healthy weight? Let me introduce you to BMI. Now, BMI simply means body mass index. Now, it is a means of ascertaining whether your weight is in a healthy range for your height. Now, BMI is divided into categories. You have being underweight, being normal, being overweight, and being obese. Now, someone is deemed underweight if the person is less than 18.5. I'm going to show you how to calculate it. But someone is deemed normal if the person is between the ranges of 18.5 to 24.9. Someone is deemed overweight when the person is between 25 to 29.9, and obese when the person is 30 and above. Now, our goal is to be normal weight, which is ranging from 18.5 to 24.9. Now, this range is the best time for your body to be able to have a normal balanced hormone and fertility to occur. Now, let us calculate our body mass index. Now, there's a formula for calculating your BMI. It is weight in kilogram divided by height in meters squared. Weight in kilogram divided by height in meters squared. Or simply, you can use your BMI calculator apps. There are apps for it that will make it easier and quicker for you. But you have to know your weight. So you have to weigh yourself to know what is my weight, and then you also have to check your height to know what is your height before you can actually carry out the calculation. So once you know your BMI category, you can easily take steps to work towards a healthier range that is going to naturally boost your fertility. Eat fertility-friendly foods. Now, fertility-friendly foods are simply foods that will boost your fertility. Now, foods like eggs, foods like fish, foods like beans, green leafy vegetables, salmon, whole grains, they all help to ensure that your hormones are at the balance level and also improve the quality of your eggs. Remember the eggs I'm talking about. Number 4 will be to reduce your stress or to manage your stress. I know that stress is part of life, and it is not possible to completely eliminate stress from one's life, but it is very possible to reduce your stress or to manage your stress level, because stress is very potent. If you are stressed as a woman, it is very possible you won't even see your period. Yes, stress can make you not to see your period. It happens. Okay, so you can imagine if someone is being stressed and not seeing her period. If stress is strong enough, potent enough to stop someone from seeing her period, you can imagine other things that you can do, because stress affects ovulation, if you're not aware. And I've talked about what ovulation is. So you want to try as much as you can to manage your stress. Okay, taking warm baths, going for a walk, journaling your thoughts, practice deep breathing, praying, or kind of doing activities that will generally make you feel calm or happy is very, very important, especially when you notice that you are going through a stressful phase in your life. It is very important. Take deliberate steps to reduce your stress. Number 5 will be to limit your caffeine and alcohol intake. I'm not going to talk much on this because I feel when it comes to alcohol, there is already enough knowledge as to knowing that alcohol can be very, very dangerous, especially for a woman who is trying to conceive. Honestly, I would advise, if you are told stop this by your medical personnel or your doctor or your nurse, and it will help increase your chance of getting pregnant, why not stop it? You want to go, there's something you desire. So if it means limiting your caffeine, means limiting your alcohol, or even stopping it in total, please do so. All right, you want a very, very healthy environment in your body to help you prepare for your pregnancy. Also, I would say get enough sleep. I know life is lightweight, right? Stress is stressing, and at times in life where you realize that you are getting short hours of sleep, you notice that if you don't sleep adequately, it affects your brain. I know everyone experiences that. There are times when you don't sleep adequately and you realize that you are being foggy because you have not slept well. Your face is looking tired and weak. You are just weak, no energy, and then your face, you're already having eye bags already, very, very deep one, because of not sleeping. You can imagine now what is going on the inside of your body. Please try and sleep. Aim for 7 to 8 hours of sleep every day in total, at least 7 hours of sleep every day. I know that we push that a lot, but please, it's very, very important. Also, I would advise that you take folic acid early. Yes, folic acid. Take it early. Now, one thing with folic acid is that it prepares your body for pregnancy and it helps to support early development. That is why you notice that women who are pregnant, folic acid is usually given to them as part of their pregnancy medications in the hospital. So taking folic acid can be very, very important. Most women take about 400 micrograms of folic acid daily, but always ensure that before taking any medication, actually checking with your healthcare professional for to avoid smoking and excessive heat. Avoid smoking. Avoid smoking. Avoid smoking as a woman. You need to avoid smoking, especially if you want to conceive. Now, smoking does reduce fertility, and excessive heat can affect reproductive health, especially for men. Things like placing laptops on your laps or having hot baths or wearing tight undergarments can reduce the quality of the sperm. So it's important that you quit smoking if you do smoke and avoid any form of heat around your body. Okay, now that we have known all of this, when do you seek your healthcare professional? It's important that you go to the hospital when you notice that you have been trying to conceive for 1 year and you have not had any result. You have been trying to conceive for a year straight, having unprotected sexual intercourse, and you have not been able to conceive. Then you should go to the hospital. I feel both as a man, as a woman, and as a woman, it's very important. Also, if you have been trying to conceive for about 6 months and you are already over 35 years, you've been trying to conceive for over 6 months, you're already over 35 years, then you should go and check in with your healthcare provider. Now, the thing is that fertility can take time. That's the truth. Fertility can take time and it requires a great deal of patience. Okay, you have to be patient with yourself, whether you're a man for a woman. You have to be patient with yourself. And I know that even though it takes time, carrying out the necessary steps, improving on your habits, knowing and observing your body can help improve your chances of getting pregnant or help you in your fertility journey. So let me know in the comment section, have you tried any of these natural methods I've talked about, and how far, what are the changes that you have noticed in your body? Please let us know in the comment section, and also try to recommend videos that you love to see. Until I see you next time, bye lovelies, and God bless you.